Sego Guego. Hello, everybody. Today I'm wanting to give information on the upcoming mandatory evaluation of the First Nations Health Authority and also the tripartite framework agreement uh, that was developed with BC First Nations on the First Nations health governance. That is really part of our agreement for evaluation every 5 years. So we've recently concluded our second cycle of these evaluations, and it was really important to help shape the work over the last few years. And we're now undertaking work to do this second and subsequent evaluation. I would say that we really have some important developments that are worth reflecting on. Partially, I would say, looking at the approval of the new 10-year agreement. I think that's a significant milestone. In addition, approval of the 10-year strategy on social determinants. And I would also add that there have been some really innovative developments in the areas relating to both land-based and also other cultural healing methodologies. So these are really significant and really reflect on our collective commitment to bring culture into everything that we do. Lastly, I would add that the development of a cultural safety and humility standard has been a really significant development and is part of our attempt to deal with racism against First Nations people in BC. So they're not only significant for now, but also lay the pathway for improvements in the future. I would say it's also important to reflect on the developments such as the discovery of the 215 graves, the pandemic, and the work that was done to provide vaccines on a very timely basis, and to make sure that First Nations had an important focus in a community-wide approach to better serve First Nations needs and to suit these circumstances health-wise faced by First Nations people in First Nations communities. But also one of the learnings from that really was that it is very hard to differentiate between on-reserve populations and those living away from home in urban areas, and that there's so much flux and exchange between these groups that it makes it important for us to have an overall focus on First Nations people, regardless of where they live. So I would also add to that the toxic drug crisis, which has in some ways had a more profound effect on First Nations people, and also the continuing challenges relating to climate emergencies. So I would say these have sparked innovations and ways of improving response and services, such as Doctor of the Day and other ways to deliver services in these challenging circumstances. But I would say it's really important that we reflect on these and then reflect on our need and our willingness and our commitment to walk side by side with communities throughout our path forward over the next few years. So in order to support that, the health governance and partnerships and relationships that are enshrined within the tripartite framework are really important to reflect on and to have comments on. And I would say that that's the purpose of the evaluation, is to provide for that continuous improvement and to help guide FNHA and our governance partners, the Health Council and Health Directors Association, in terms of making those needed improvements and continuous quality improvement really being a focus for us. And lastly, of course, this all relates to transparency and a commitment to moving forward and addressing the outcomes of the evaluation and the recommendations that are expected from those, both our first evaluation and this one coming. So in closing, I just want to emphasize that this is a way to really advance and improve and maybe even focus the work that's being done, but also as a way to examine what's been achieved and to reflect on ways to improve this going forward. And I would say that it's really important that leaders, that health directors participate in this evaluation in an effective way in our first go-round, because this really is a way to have your voices heard and to make sure that this evaluation is also done in a way that it's really helpful to our collective approach going forward and to all of the work that needs to be done. So with that, thank you for your time, and I really hope everybody will embrace this opportunity to evaluate our overall governance framework.